Hey everyone! Today we're going to dive into 3 powerful CBT techniques that can help you overcome social anxiety. But before we jump into the techniques, let's first take a moment to really understand what anxiety is. Anxiety is that familiar feeling of worry, nervousness, or unease. It usually creeps up when we're facing an event that feels threatening or uncertain. It's our body's way of saying something might go wrong. Now, when we narrow that down to social anxiety, those feelings of worry and nervousness are focused almost entirely on social interactions. Things like meeting new people, speaking up in a group, or even just being the center of attention. And to effectively deal with social anxiety, we need to break down anxiety as a whole. So, what exactly makes up anxiety? Well, psychologists understand it as being sustained by 3 different components: the physiological component, the cognitive component, the behavioral component. Let's go through these one by one. 1. The physiological component. This is how anxiety shows up in your body. Maybe it's a racing heart, sweaty palms, a flushed face, or even feeling dizzy and faint. For many people, this is the first part of anxiety they notice, because it's so physical. If you've ever had a panic attack, those overwhelming symptoms fall into this category. 2. The cognitive component. Cognitive is just a fancy word for thoughts. When we're anxious, our mind fills with predictions of failure or embarrassment. For example, many of my patients with social anxiety tell me things like, "I'm going to make a fool of myself," or "Everyone's going to think I'm boring." These automatic negative thoughts shape how we see ourselves in social situations, and they fuel the cycle of anxiety. 3. The behavioral component. This is what other people can observe in our actions or our lack of actions. Maybe you avoid eye contact, look away, speak very softly, or rush through conversations. Sometimes it's not what we do, but what we avoid: skipping lunch with coworkers, not attending gatherings, or steering clear of situations where we might feel judged. Even avoidance itself is considered a behavior, because it's noticeable when we pull away from something due to fear. Here's the thing. Most people don't just experience one of these components. In fact, these 3 almost always work together, reinforcing each other and making anxiety stronger. For example, imagine your boss walks up and says, "I'd like to see you after lunch." Immediately, your thoughts kick in. "Oh no, I must have messed something up. I'm in trouble." Then your body reacts. Your muscles tense, your heart races, your palms sweat. Finally, your behavior changes. You might dread the meeting, avoid walking into their office, or struggle to look them in the eye when you finally do. That's how all 3 components, thoughts, body, and behavior, combine almost automatically when we're dealing with social anxiety. So, in order to overcome social anxiety, we really need to push back against all 3 components: the physical, the cognitive, and the behavioral. The very first step in this process is something called systemic graduated exposure. Now, that phrase might sound a little intimidating, but honestly, it's just a fancy way of saying that we need to slowly and systematically expose ourselves to the things that scare us, those anxiety-provoking situations, until they're no longer so scary. I've talked about exposure therapy before, and this is very similar. The key difference here is that this approach is specifically tailored to treating social anxiety. And here's something important. This kind of exposure is most effective when done with a trained mental health professional. Why? Because in therapy, we can role-play different social scenarios, get real-time feedback, and safely test out the situations that make us the most nervous. For example, let's say you're terrified of speaking up during a team meeting. In therapy, you can actually practice what you'd like to say, role-play how your coworkers or your boss might respond, and then get constructive feedback on your delivery. It's like a safe rehearsal space before the real thing. This kind of practice works wonders because it lets you say what you need to say, play out how the other person might respond, get immediate feedback on how it went, and, maybe most importantly, it gives you enough time to see that all those uncomfortable bodily responses like shaky knees, sweaty palms, or a racing heart do fade away if you stay in the situation long enough. Here's the tricky part. Most of us don't give ourselves that chance. We assume that if we don't leave or escape right away, we'll just feel terrible forever. But the truth is, anxiety naturally peaks and then drops. The more often we stay in those situations, the quicker our body learns, "Hey, this isn't actually dangerous." Exposure also helps us test out our anxious predictions. For example, maybe you're convinced that if you give a presentation, you'll sneeze all over your boss and have to run out in shame. In therapy, You can practice giving that presentation while your therapist role plays your boss. You quickly realize how unlikely your catastrophic scenario really is. That's exposure in action. It shows us that our anxious beliefs are often faulty. Step 2. Cognitive Restructuring. The second tool is something called Cognitive Restructuring. Again, it sounds technical, but what it really means is this. We start to question our anxious thoughts, beliefs, and assumptions instead of accepting them as fact. Take the example of worrying you'll sneeze on your boss mid-presentation. Cognitive restructuring helps us pause and ask, how realistic is that really? What's the actual evidence that this will happen? In therapy, you and your therapist can work together to identify these anxious beliefs and gently challenge them. Are they accurate? Are they helpful? Or are they just making your anxiety worse? This can sound a little scary at first, but remember, it's done slowly, safely, and at your pace. Sometimes it's as simple as writing down your fear, looking at it in black and white, and asking, does this actually make sense? And the great part? By questioning your anxious thoughts, you're not only changing the cognitive component of anxiety, but you're also reducing the behavioral avoidance that comes with it. It's like getting two benefits at once. You can even start today, right now, by noticing, what am I afraid will happen if I do the thing that makes me anxious? Just the act of questioning those predictions begins to break their power. Step 3. Practicing in real life. Finally, Step 3. Real-life practice. Every effective treatment for social anxiety includes homework outside of therapy. Why? Because practicing only in the therapist's office won't magically make real-world situations feel easier. You need real-world reps. Homework might involve trying out one of the things you role-played in session, keeping track of your anxious thoughts during the week, reading a recommended book or workbook exercise. The most important part is being honest with yourself and your therapist. Don't just say, yeah, I'll do all the homework, if you know you won't. If it feels like too much, or if you think the pace is too fast, speak up. That conversation itself is a valuable exercise. You're practicing assertiveness and self-advocacy, which are key skills for overcoming social anxiety. Remember, the goal isn't perfection, it's progress. Step by step, practice by practice, you'll notice your body calming down faster, your thoughts becoming less catastrophic, and your behavior becoming more confident. So, to wrap it all up, use systemic graduated exposure to face your fears in safe, gradual steps. Apply cognitive restructuring to challenge and reframe those anxious thoughts. Practice consistently in real life with honesty and patience. With time, effort, and the right support, you can absolutely reduce your social anxiety and build a healthier, more confident version of yourself. And remember, you're not doing this alone. You and your therapist are a team, working towards a healthy mind and a healthy body. See you next time, and take care.